Now we have a group representing the D1 Now study, which is a fantastic piece of ongoing work here in Galway, aiming to kind of better understand and support young adult self-management in type 1 diabetes. So we have two young adult panel members, Cameron and Ciara, who've been part of this panel since the very beginning, all the way back in 2014, and Dr Bláthín Casey, the project manager. So thank you.
Thank you, Lisa. Yeah, thanks. Microphone's working? Yeah.
We only have one.
We can share. Hello, everybody. So I'm conscious that we're between lunch, so we are going to keep to time. So Una, if you don't mind telling us if we're not, I have my phone here as well. We're going to work this slightly different. I think Edel Murphy, are you here in the room, Edel, wanted us to do this as a talk show kind of thing. So we were toying around, I think, whether we were going with Late Late Show, Oprah Winfrey. Ciara was suggesting maybe Jeremy Springer or Jeremy Kyle, but we'll see how it goes. Hopefully we'll all be friends at the end of this. So I'm just going to give a quick introduction. So as Lisa said, my name is Bláthín Casey and I'm Programme Manager on what's called the D1 Now study. And Ciara and Cameron are working with us as part of the D1 Now study team. And we have a couple of other key people in the audience that are members of the D1 Now study team as well. So we have Prof. Sean Deneen, who is leading out as PI on this HRB funded award. We have Molly Byrne as well in the front. And we have past members of D1 Now as well, Lisa Hines as well, and Mary Claire O'Hara is in the audience as well. So D1 Now, in essence, and I won't spend too long telling you about what D1 Now is. We're going to get straight into the conversation with Ciara and Cameron. But D1 Now aims to improve outcomes among young adults, so age 18 to 25, living with type 1 diabetes. The study is called D1 Now. So we're in the midst of a HRB-funded DEFA award, so Pilot RCT award, and that's kicking off in September. Ciara and Cameron make up what's called the YAP, so the Young Adult Panel, which is our PPI group within D1 Now. And Ciara, you were telling me, I think it's 5 years to the date in...
Yeah, so we had our very, very first, our setup meeting was the 14th of March, 2014. So both myself and Cameron were at that very first meeting, and we've been involved in the panel since then. So we're 5 years.
Yeah, and that's where our title comes in, designed by Ciara at our last YAP meeting. So 5 years on, and a question mark around five years more. So I'm going to kick off, and I'm just going to get Ciara and Cameron to introduce themselves. So Cameron, if you don't mind starting, if you wouldn't mind just telling everybody, I suppose, who you are, maybe a little bit about your diagnosis with type 1, when you joined the YAP, and maybe why you joined the YAP as well.
Yeah, sure. So my name is Cameron Keighron. I was diagnosed with type 1 diabetes back in 2011 when I was 16, which is quite uncommon for a type 1 diabetes diagnosis. Generally speaking, it's a lot younger than that. So I was in the midst of my leaving cert, not the most ideal timing to be diagnosed with a chronic illness. And I suppose when I was diagnosed, I suppose for the first couple of years I took it very well. I kind of just took it in my stride, but I did kind of struggle with the diagnosis, kind of coming to college and seeing myself maybe as different to my peers and different to the people around me, and having to plan for different things. And I got involved in the project. I was interested in research, but primarily my mother called me and said, "You're going to go do this thing and talk to people." I'm 25 next month, and my mother is still the scariest person on the planet to me. But I went along, and for me, we were talking at the last kind of Young Adult Panel meeting. One of the main things that I wanted to get out of it, apart from contributing to the research, was also just seeing that other people had diabetes and were doing things with their lives. That this wasn't going to be a barrier to me completing my education or going into sports, that I could see that everyone was living normal lives and diabetes was just a part of that. So that was one of the motivating factors there.
Yeah, brilliant, thanks Cameron. And we're going to touch on a later question around that idea of being a member of a PPI panel, whether it can be considered a support group for members of a PPI panel, and we'll talk about that a little bit later. It's Ciara.
So my name is Ciara Duffy. I was diagnosed type 1 diabetic on the 4th of November 2001, so I've had it for 17 years. My diabetes will be legally able to vote next November. So I I was 7 when I was diagnosed. I barely remember what it was like before my diagnosis. I essentially have lived more of my life with diabetes than without diabetes. It's shaped so much of my personality, so much of who I am. 10 years after I was diagnosed, my younger sister was diagnosed, so we're 10 years apart in age, and our diabetes is 10 years apart exactly. She was diagnosed the 3rd of November 2011, so we're literally, our anniversaries are a day apart. She was the exact same age I was. I have been involved in sport quite a lot, so diabetes and sport can be quite hard to mix, so you have to try and balance and find a balance with that. My main reason for getting involved in the YAP was because diabetes has been so involved in my life, and I constantly in and out of doctor's offices every 3 months, every 4 months, every 6 months. Changing the way that we interact in the hospitals and interact with the nurses and the doctors, because after a certain point you kind of start to realise that it's very clinical, it's very structured, it's very X, Y, Z in every question that's answered. A lot of things aren't taken into consideration when you go into a clinic. Going into this, I knew that the study, like we're 5 years into the study, I'm almost aging out of the clinic that we're aiming to work with. But it's going to benefit my sister in the next couple of years as she moves into the clinic. So it's benefiting the next generation is kind of where I came from, because I knew I wasn't going to be able to get the benefit out of it immediately because the research wasn't going to be completed. We weren't going to be able to get that done.
Brilliant. Perfect. So I'm going to allude to the title of the presentation that Ciara very greatly came up with, 5 years on, 5 years more, with my first question. And Ciara, I might throw this to you first. I suppose 5 years on, what has kept you coming back to the YAP and being here still today?
Basically, pizza keeps me coming back. So all of our sessions we go to, like, we're all young adults, we're all working, we're all in college, we're all coming, like I'm living out in Westmeath, so I'm driving an hour and a half to come down to meetings. Cameron's coming from work, a lot of the guys are coming from work, are coming from classes. So being able to go to a meeting and not having to worry about trying to eat and making sure you need to eat before, especially with diabetes, you can't go into a meeting with a low blood sugar. It's not a fun experience. We're being looked after. We know that when we go to these meetings, it's understood that we're contributing something to the research. The researchers that are around us understand that it is something that's going to have an impact on what we do. If we're able to eat and we're fed and watered and stuff like that, we're more mentally prepared to take part in what we're being asked to take part in. It also then helps that with the research, we're on a lot of the research papers that have been released to do with the study, we're all cited as co-researchers. We're included in the research. What we have said and what we've done in the meetings for the last 5 years have influenced the research, and we're benefiting from that. Like, I'm applying for jobs and they're seeing that I have that background in research, that I've contributed to research. So it's benefiting us in that extent, in that frame, as well as benefiting us. We're showing up to meetings, we're getting fed, we get paid in vouchers for showing up to the meetings. It's something small, but it's showing that we're valuable to the research, that our input and our opinions and decisions and our way of reading a room or reading a paper and viewing it slightly differently to the way the researchers normally would is valuable to them. So it's being shown that we're worth something to the research.
Brilliant. Cameron, anything to add? Yeah.
Yeah, I think I'd agree with a lot with what Ciara said, but there's kind of like two things that kind of have empowered me to come back, and one of them is very much the team that's in place. We trust them and they trust us. And that's super, super important to me, that I know that I can walk in there and I can say whatever's on my mind about the research, whatever's on my mind about diabetes, and that it's listened to, but vice versa, that the team can come to us and say, okay, we understand and respect where you're coming from, but within the confines of this research or what we want to do, this is how we're looking at it. And there's that open dialogue and that open communication with that. And then also, like, one of the most important things to me was that what Ciara said earlier about the fact that this research realistically isn't going to benefit us in the age category that we're looking at, but by the fact that we're a part of this research, and when we talk to parents of other young diabetics, there's one in particular that we were working on developing an equality workshop, and it just so happened that her 8-year-old daughter had type 1 diabetes. And first of all, she wanted what I wanted when I came to the panel first, and that was to know that her daughter was going to grow up and live a fulfilled life, but also that her daughter was going to grow up in a clinic that listened to what she wanted. And we can really be that voice for those people as well, and to maybe put fears to bed for some people that, yes, maybe the clinic isn't working right now for you, but that people are putting their time and effort into it, and they are trying to make it better for generations to come. And that's something that I really enjoy, that aspect of it, by contributing to this research and keep coming back to it.
Yeah, I'm going to thank you for that. I'm going to follow up, and Ciara, back to you. Cameron, you mentioned, I suppose, your reasons for keeping coming back, and you two are great pals. I know that now, along with some of the other members. I think Michelle, is that yourself? Michelle is here. There you are, Michelle. Hello. And Anthony, I think Anthony, we have a couple of other YAP members in the audience as well. What are your thoughts on this idea of a misconception of being a member of a PPI panel or being a member of the YAP being seen as a support group? And I think at your very first meeting when you were recruited with Mary Claire O'Hara and Sarah Simpkin from Jigsaw, you were told this is not a support group. Ciara, I think you have some thoughts on that.
Yeah, so the YAP for us, it's not a support group, but it is in a sense. So we're not going in and we're not talking about our problems. We're not going in and saying, I'm having a bad day with blood sugars, I've had a bad couple of weeks. That's not what we're going in to do when we go into the meetings. But being around other diabetics and seeing that other diabetics are, like, we'll talk before the meeting starts, we'll talk throughout the meeting if we go off on a tangent, which we're wont to do on occasion. And like, even sitting around the table when we sit down, the pizza comes in and we're all taking out blood kits, we're all taking out pens or insulin pumps and bolusing for the food, correcting for our blood sugars. Being around other people who understand that you're going through that, and it's like, I've sat down in normal restaurants and you have people staring at you. Like, I sat down with my sister and she wasn't doing her own insulin at the time. I was using her pen to give her an injection, and I had a gentleman give out to me for injecting her at the table. But it's just being around other people that know what that's like, and knowing you're going to be able to do that and it's not going to be an issue is very, very beneficial to us, because you're not then having to defend yourself. You're just eating. You're just being around other people. They're experiencing the same things as you, and it's knowing that other people do it and other people see it. And even if we're just kind of going, damn, this isn't working, my pump's blocked or something like that, and knowing everyone's kind of like, oh yeah, I had that last week, or oh, that keeps happening to me with that model as well. We're not there to solve our own problems. We're not there to solve each other's problems. We're not there giving advice to each other. We're not there fixing things for each other. But it's that camaraderie, knowing that if I turn around to Cameron and I was like, oh, have you got glucose tablets? My blood sugar's low. There's a high chance someone will have them. And it's just so blasé that's like, oh yeah, here. It's not an issue. In that sense, the support is there and it is beneficial. It's great to see that there are other people around you that experience the same things you're experiencing. Even though we're all in such different fields, we're all in such different points in our life, it's kind of one of the best parts about the research outside of the research.
Yeah, like I definitely feel like, and this sounds a little bit weird to say, but for me, it really normalized having diabetes, even though I had had diabetes for a number of years. It was kind of the first interaction that I'd had since being diagnosed, where even though the diabetes was the main focus of it, because that was the research, the fact that I had diabetes didn't really become a huge issue. It was a case of we got to bring our lived experience, but everything outside of that also mattered. What we thought critically of papers that we were reading, what we thought about the way forward for the research. And I think, I remember there was one time, the group of us, we went out for the actual, a few of us went out for dinner. And this was about maybe like 2-3 years into the project. And it was at that point that all of us turned around and realized, actually, none of our diabetes is actually in the best of place now. But before that, we had built up this thing in our minds that every other person that was in the room had the most excellent control and the excellent diabetes, and that's why they were selected, and that we were the black sheep in there, that we were the one to talk about the fact that we had really bad diabetes. And I remember my mind being blown by this, being like, wait, everyone is this? But like, we were told that it wasn't a support group, and we didn't treat it like a support group, and it wasn't a bad thing that this took 2 or 3 years for us to realize. But again, just seeing other people do things, and like all of us are friends on social media, and we sometimes we meet up, and seeing that we're doing things like graduating from college or starting a new job or traveling, really kind of, we were contributing beneficially to research, but also we were developing and moving on with our lives and showing that, yes, we had diabetes, but it wasn't going to hold us back.
Brilliant, perfect. I'm going to fire ahead. I'm going to onto, I suppose, discussing what you have done over the last 5 years and what has been meaningful to you guys. Maybe not myself or Sean or Molly and co, but to you over the last 5 years. What are 1 or 2 things that stick out to you as a time that you were listened to and you felt you did make an impact on D1 Now and the study?
Yeah, I suppose like, as I said, we've been involved for the last 5 years, so we've had lots of opportunities to take part in every element of the research. And I'll take a couple of the more kind of solid examples that I can give. And one of them being a text messaging service called Florence, which is primarily, it was used in the UK, but it was essentially a system that's set up that would text you 2 to 3 times a day to ask you to reply with your blood sugar levels. You had different things around sick day rules or drinking alcohol, and then there was a 6-week kind of motivational program, which was interesting. But myself and Michelle, who's in the audience, the 2 of us piloted this in a pre-pilot pilot. To see what it was like and whether or not it was something that would be used in the research going forward. And for those first 6 weeks, you couldn't get me to stop using it. I absolutely loved it. I thought it was the best thing ever. The motivational messages were a bit cringy. They've been taken from a pediatric model in the UK. So some of them were kind of like based towards maybe like 8 to 12-year-olds, which, to be honest, some days I was like, that's really cute. I will have a good day, thank you. But at other times it was kind of like maybe not the thing for me, but we got to go back when that was finished, and we kind of went, okay, well, this needs to be updated or this needs to be changed. And the entire Florence system was changed and adapted for the actual pilot going forward, which very interestingly, a few of us took part in as well, and turned out that we hated the system at that point. There was no real massive differences. I just think at the time it fitted with our lifestyle, and then the second time it really didn't. And Bláthín and Ciara can tell you that the YAP have very strong opinions on Florence, but they're listened to. And I went into Bláthín and I said, look, I really want this element of this text messaging service, and I want only this. And that was set up. But that also created a pathway that if Florence was to be used going forward to help treat young adults with type 1 diabetes, that there was already a precedent set there that it was a model that was really, really adapted to the patient in question, and really adapted to their lifestyle. And throughout the entire research and throughout anything that we do, if we say, oh, we really love something or we really dislike something, that's always taken into consideration. Like, we've had times where we might go in and to be honest, I don't know how sometimes the research team take it, but we do actually kind of slate things, and we're like, no, this is crap, we don't like this, change it. And to be fair to them, they take it in their stride, and they really listen to what we want. And it's coming out of a point of view of our experience. Myself and Ciara were talking when you talked about the survey, Your Voice Matters, and the triangle of how you felt in a clinical setting in an appointment, where it was human being, a burden, or a number. And we made a joke, but it is actually serious, that I don't think I can actually pinpoint a time where I've seen maybe a registrar or gone to a clinic appointment where I haven't just felt like a number. And I don't think I can pinpoint a time other than in the YAP where I could tick the box and say I actually feel like a human and listen to. And the research team really take that on board and really try and get our opinions. And sometimes we're not always forthcoming with those opinions. Sometimes we don't want to be negative about the setting that we're in. And that was a struggle at the start to get us to actually open up and talk about the problems that we had within the clinics that we were attending. The meeting that we did actually open up was a whirlwind for everyone, because we kind of had gone through a couple of meetings being like, no, it's okay, this is fine. And then eventually we just became comfortable enough to be like, actually, this is really shit and I don't like it. Can we please change it?
There was a lot of negative comments at that meeting. It went over by half an hour. So our meetings are normally 2 hours. We were 2.5, almost 3 hours there. And I think, was it Mary Claire at the time? And I think they walked out of the meeting and they were quite shocked that we had actually turned around and been so, okay, this is what we really, really think at this point.
Ciara, I think you hit the nail on the head there about meetings going over time, because Lisa got the whisper in the ear. Yeah. So I think I'm going to finish up, and there might be a time for maybe one question from the audience if Lisa allows us, we'll see. But just to finish up, Ciara and Cameron, just to both the researchers in the room who are already maybe actively involved in PPI, or to some of those that might be starting the journey of involving PPI in their research, would you mind finishing with your one top tip for successful PPI in research? So Ciara.
I think my top tip, if you're going for a model kind of like we have, is peers, not patients. So treating the PPI group, our young adult group, they're peers in your research. You're not treating them as patients in all cases. They're forming the research, they're helping direct it. They're not always looking for you to treat what they're dealing with at the time.
Brilliant. And Cameron?
Yes, it's something that's really important to me, and it's a phrase I kind of use quite a bit, and it's to speak with and not over, and to ensure that when you have PPI elements to your research, that you're empowering those patients to speak up, and to give them the platform to do that, and to not do it in a tokenistic way. We have seen in research previously where PPI elements come in way too late, so to make sure that they feel valued, to feel empowered, and to speak with them and not over them.
Lovely, thank you very much. I'd like to take this opportunity just to thank the Primary Care Clinical Trials Network and PPI Ignite, and I suppose just finishing with our two thoughts on peers, not patients, and speak with and not over. And thank you very much, Cameron and Ciara, for being here today.